For the debate, the member for Thornhill.
Thank you very much, Mr. Speaker, and I'm pleased to rise today to speak on Bill 91, Empowering Home Care Patients, which was put forward by the member from the third party from Windsor West. And I was listening very intently, and I was surprised that nobody jumped up and suggested that maybe we were going a little bit off topic. In terms of all this talk about that the only way that we can fund any programs whatsoever is by raising taxes. Mr. Speaker, how much is too much? People are paying in taxes, income tax, municipal tax. They're paying a gas tax. They're paying a sales tax. How about if we prioritize? How about if we're careful with the money we do collect? How about if we don't waste money on scandal after scandal, even the OPP investigations? Well, nobody interrupted when you were completely off topic. 4 OPP investigations and possibly a 5th underway. Who is paying for those OPP investigations? The taxpayers of this province of Ontario. Taxpayer dollars for OPP investigations when that money could have been going to home care. The people of the province of Ontario understand very well what's going on. They understand that 1% of their taxes going to provide health care is not sufficient. They're willing to pay a significant amount of taxes, but guess what, Mr. Speaker? They're already paying a lot in taxes. We cannot expect people to provide shelter for their families and food for their kids and have a healthy lifestyle and go on camping trips, which I enjoyed with my family when I was younger. They want to see the government prioritize their valuable tax dollars. I was visited by Lauren Freed from the Alzheimer's Society of York Region. My riding of Thornhill, of course, is in York Region, and it was quite heartbreaking to see 2 gentlemen who came with him. One is a caregiver for his mother, and the other is a caregiver for his wife. And thank goodness that there are programs in York Region, in our community, where patients with Alzheimer's can go during the day. And thank goodness that we do have healthcare workers who are providing home care. But I think that we're all told to look carefully at charities before we give them our valuable after-tax dollars, Mr. Speaker. And many people feel that 80% of the money should go directly to services for most charities, and if they see it go further askew from 80-20%, they say that charity is not getting my money. Some people even say it should be 90-10% or 100% of the money. Well, maybe that's what we have to have that discussion and say CCAC should be a significant amount of the money, perhaps 80% has to go to frontline health care, and insist on that. And if the administrators can't do it, then maybe those administrators have to provide the frontline health care that they're tasked to do. So we're hearing that the Welland Hospital, we were just hearing today from the member from the third party, that the Welland Hospital will be closing. Well, how are we here talking about prioritizing tax dollars when we're talking about shutting down health care in a community? Families drive their parents and their children and themselves to appointments. If they have to go further, that's more time off of work and more time away from their family and their tasks. If people have to drive further for health care, we all know what happens. Oftentimes they don't make it to the hospital in enough time to receive the care that they need in a timely fashion. We can definitely do better, and it's about, in my opinion, it's about prioritizing the money that we're already collecting. I don't think that it's fair to constantly go with our hands out to the public when the public is struggling, Mr. Speaker. We could definitely do better, and I appreciate the suggestions in this bill that we have to respond to complaints within 30 days instead of 60 days. Well, in my riding of Vaughan, 4 complaints, I'm told, were made against a home daycare, and this government didn't act upon them. And a little girl, unfortunately, died under terrible circumstances. So it's not enough, unfortunately, to just say we'll investigate, and we heard the member from Ottawa Orleans said that it's a priority for her and her government to investigate any complaints. It's not enough to say that we're going to investigate. We have to investigate. It's not enough to just have ombudsman. It's important that we manage the complaints immediately, through the Ombudsman, but also the complaints that come to the ministry themselves. They shouldn't have to all go through an Ombudsman. Thank you very much, Mr.
Thank you very much. Further debate?